An ASD stands for an atrial septal defect. The atria are the collecting chambers of the heart, and you have a right atrium and a left atrium. And an ASD stands for a defect or an abnormal connection between the two. It's not terribly rare. It affects 1 to 2 children per 1,000 children born, and it represents about 15% of the congenital heart disease that we treat in patients. It's hard to know if your child has an ASD. Most atrial septal defects are actually asymptomatic. You wouldn't be able to tell that your child has an ASD compared to another child. So we really depend on the general pediatrician when they listen to your child's heart, if they hear a murmur that sounds abnormal, or if they hear what's called a fixed second heart sound. Those are some of the signs that we look for with ASDs. Then your general pediatrician will refer you to the pediatric cardiology clinic, where a cardiologist can listen, confirm, and then get an echocardiogram to confirm the diagnosis. The best treatment plan for an ASD really depends on the size of the ASD and the child. Small ASDs sometimes require no treatment at all. We can just watch it or even say it's not a problem, you don't have to worry about it. Moderate to large ASDs usually do require treatment because if they're left for too long, they can lead to long-term problems like dilation of the heart, arrhythmias, and very rare situations, a problem called pulmonary hypertension in older age. So for those reasons, moderate to large ASDs, we close. And we really have 2 options for closing. One is a transcatheter option, and the other is a surgical option. And choosing either of those options really depends on the size of the hole, its location, and whether or not there's ability for a transcatheter device to close the hole successfully, or if a surgical option is better because the hole is either too large or too close to the normal structures of the heart. The best treatment plan for your child is really dependent on you and your child's situation. For younger children, we usually watch atrial septal defects for some time because some may close on their own. But for moderate or large defects, especially when the child is more than a couple years old, we'll talk about the best treatment option that works for your child and family.